My name is Carl Holliday. I'm the health physicist for Navajo Land program, and I've been here 13 years. And I pretty much overlook the health physics portion for the department, which is pretty much maintaining the instrumentation, radiological instrumentation, and trying to prevent exposure, minimize the exposure levels for our contractor personnel and our own personnel. And I do the analysis whenever the data, send out the data, I pretty much get it back and then record those and then monitor, see what kind of exposure that we're receiving. I also get involved by implementing procedures, plans of how we're going to be doing the monitoring, how we're going to be doing the daily QC checks of instrumentation. Make sure that we're at least following a guideline to where the instrumentation are all in good working order, calibration portion. And then my other duty is health and safety officer for the department, and just kind of overlook the health and safety, do equipment inspection, job site inspections, and kind of when there's actual construction, go out there and do the on-site inspections. And then if there's any issues related to safety, accident investigation, or even just some minor injury investigation, I get involved doing that, and then I do the reporting. And we do work with other departments quite a bit. So mainly on my part is I work with the EPA, Navajo EPA. I work with Navajo OSHA, and then some of the other programs like people from other organizations like New Mexico and AML, Utah AML, some of their consultants. I do trainings and all that, so kind of expand that out to it helps other people. My other duty is working with the Navajo UMTRA program, and basically all that is just kind of overlook the some of the issues that like phytoremediation, kind of making sure that they have their full tanks or water is available to their plants. And I go assist in some of their job and site inspections also. Make sure that Stoller, that the contractors, that they're pretty much following their in compliance, and I assist in that manner. So that's pretty much what I do for Navajo AML. All we do is just try to minimize the exposure levels. We just inform people, so there's always that risk involved of any exposure. I can't say, this person, if you receive this much, you're going to be okay. It also depends on the bodily, the person's body, how much uptake it can receive and have no impact or effects from it. So that's one of the reasons I always stress in my training, say, there's always a risk involved, that any exposure could be some harm. Navajo AML, when I started working for it, they were kind of the leaders in saying, okay, this is how we're going to establish these procedures. This is how we're going to address these sites. This is how we're going to be doing the cleanup. And all that, we were kind of at the same time being constrained by the laws within the SMACRA and saying this is only what you can do. And this is only the amount of work you can do. And then that's when we built in our in-house guidelines. And nobody said anything about it. And we worked with it for probably 10 years. And finally, other regulatory authorities, agencies, after about 95% of our projects are complete, then they say, you know what? We think we have a better idea than yours. So what do we do? Do we go back and just redo some more mining or do some more additional cleanup? And some of these companies, these organizations, they have big fundings that come to them. And they say, this is how you should have done it. While Navajo AML, I think, again, we address a big area using the limited funding that we were receiving. And we covered 95% of the problems that was related to uranium mining. The guidelines that we established back 10 years ago or before that, and I just kind of helped to get revise it to where it's working a lot better, is that, you know, we have procedures says, you know, this is how we're going to verify a site. This is how we're going to be determined that we've done our work. And then they come out and say, okay, you know what? You miss a little point source way over here in the corner. You should have cleaned that up within your as part of your work. But when we do our verification procedures, we average out areas. You know, we have the monitoring method where the people are already scanning right behind the equipment, making sure everything's being cleaned up. And then they find a little point source somewhere that's kind of way maybe outside of our project boundary. And then that's when they tell us, no, you should have went further out there and cleaned that up. And that kind of, like I said, in the ninth inning right now, they're finally telling us, maybe you should have went out there a little bit further. I think we did an outstanding job. And in my presentation, my trainings, I always commend the staff and say, you know, they did a darn good job of saying, okay, of identifying the area, the problems, and then we addressed it. And then when now that problem is resolved, is when they step in and say, you're not done with that. But within that guideline that we established, we've done a good job. Through the maintenance projects, we also incorporate new ideas, new methods, and new, better ways to reduce the chances of the spread, contamination of spread to other areas, you know. So we're always improving. We're starting to work with those programs and say, okay, how do you want us to help out? How are we going to help? How should we coordinate to where we address all these issues together and maybe to where we satisfy your program also? So that's where the direction is why we're probably finally turning.